But with Bluebook as it is today, out of anything I've ever done in this industry, my whole career, this is the first place I've ever worked where I can tell you and see an immediate impact to the member, to the plan sponsor, and that is super fulfilling for me.
Hey, what's up, guys? Spencer Smith here, host of the Self-Funded with Spencer podcast, sponsored by Pareto Health, ClaimDoc, and PlanSite. Enjoy today's episode.
How long have you been with Healthcare Bluebook, though?
It'll be 3 years next month.
What did you do before? You're a broker? Or?
I've been on the broker side.
Okay.
I did that for 10 years. Part of Higginbotham now. It was an individual shop when I worked there. It was my first really grown-up job, which I didn't interview for. I knew the owner, and he asked me if I knew of someone who could help him part-time admin stuff, and I worked in the same building while I was still in college. I told him I'd keep my eyes and ears open. Didn't know of anybody. He asked me if I'd do it, and I told him, well, right out of high school, I worked for Farmers, PNC.
Oh, okay.
And did that for 6 months and swore I would never work in insurance. So I told him, no, I absolutely will not come work for you.
Yep.
And then because I'm cheap, my senior year of college, you've got...
I'll ask you to tell all this again, but where did you go to college?
UT Arlington for undergrad, TCU for grad school.
Okay, so you grew up here then, too.
Yeah.
Then. Okay.
Yeah.
Okay.
So anyway, I had a split schedule my senior year. The classes I had to take, some were available in the morning, some were in the evening. And the office building that I worked in was close to campus. And UT Arlington is not a campus you really... At least then, you didn't hang out on.
Yep.
So I was like, okay. I told him, I said, Brian, I'll work for you between my classes, but you have two conditions. Two conditions. Number one, you've got to replace me PDQ.
Yeah.
And second, I'm leaving here every day to be home in time to watch Oprah at 4.
You were that big of a fan, huh? Okay.
Yeah. And I ended up working there for 10 years, ended up with about...
And how did you know the guy, Brian, that hired you?
So I ran a little tutoring company.
Okay.
That was in that same building.
What did you tutor in? What subject?
K through 12 and college prep stuff.
Okay.
So that's how I knew him. He had a little office there. And by the time I left, we had built a building together. He let me experience becoming a minority owner of the building with him, like legally. And I talked him into acquiring a PNC book. And so I did individual, small group, large group for us, which would be mid-market.
Wow.
So that's how I cut my teeth in the industry. And then I thought, the grass is surely greener on the vendor side, because all my vendor reps do is drive over here and pick up applications from me. That's it. What an easy job. And turns out grass isn't greener.
Yeah.
It's just different grass.
Yeah.
And I was probably one of their top producing brokers, but now that I've been on this side of the business for 15 years, I know that that's not what a vendor rep does.
No. And I've been on this side for a decade plus now, selling into consultants. And being a vendor early on or a carrier rep, I had a perception of what they are, and then obviously my perception was shattered pretty quickly. And but I like this side. I mean, we'll cover this now on the podcast, but I like this side.
Yeah, I do too.
I don't really want to be a consultant, and I can expound upon why, but I'd prefer to work with them and help them than be one myself.
Well, I'm interested in that because...
Well, so we're good, right, Nathaniel? Yeah, so let's go. We'll go ahead and go. Yeah, but please, keep ask your question.
So several times people have asked me, why don't you become a consultant, or why don't you start your own shop or go to work for one of the big ones? And I have no interest in that too. I'll spare you as to why, but typically I don't hear other people say, I've done that. I don't want to do that.
Well,
I like
so
the
I was
vendor side.
I was an analyst, so a senior analyst, doing a lot of spreadsheeting, but I did have an opportunity, all our prospects and clients, I'd go in for renewal meetings, I'd do the financials, and so I got to hear from them and work with them. But the role of the consultant, the big reason why I don't want to do it is because I just love talking about self-funding. I don't want to talk about anything else. I don't want to do compliance. I don't want to do dental, vision, life disability. I don't want to worry about FMLA. I want to talk about self-funding and the strategy around medical. So if a broker has a specialty job out there they can only do that, then cool. But I look at everything else they have to do, plus add prospecting in a vast ocean of potential clients, and I don't love that type of sale either. And so I like to look at, here's a narrower pool of people that need the services that I provide. I can hone in on them and find the ones that need what I offer and just work really deeply with them rather than have to do the type of sale that they do. So that's my sentiment, at least. I could be completely wrong, and the life could be way better than I expect. And the good ones live great lives. Like, there's no doubt about that.
Yeah, they definitely do.
But they've earned it too.
Sure.
And so I just look at it, and I don't want to, at 41 now, I don't really want to go back and start over either. So there you go. That's why.
Yeah, makes sense.
Yeah.
I can kind of relate to that.
Let's introduce you before we get too far, Gentry. So I'm here with Gentry Lynn. You were regional sales leader, you said was maybe the best way to introduce you, or at least the one I remembered, and you're with Healthcare Bluebook. So thank you so much for joining me here today on the podcast.
I'm looking forward to it. It's going to be fun.
Yeah, it's going to be a lot of fun. So we were kind of getting a little of your backstory, but I'm going to ask you to repeat some of that here in just a second. But why don't you at least set the table for the folks that are listening? What is today's episode going to be about broadly?
Want to talk to you guys about Healthcare Bluebook, and also some other things that I'm excited about just in our industry in general, not specific to Healthcare Bluebook, but really want to talk about Healthcare Bluebook and how self-funded employers utilize us as part of their strategy.
So we're going to, like, cost and quality, I know, is a part of that advocacy. I think you told me over
cost,
coffee.
quality, appropriateness of care.
Yes, appropriateness of care, which I think was a hot button topic, at least for a LinkedIn post I had this week. So we'll dig into that a little bit. But Healthcare Bluebook is something that's been on my radar for a number of years. I think I remember how old is Healthcare Bluebook?
We've been around nearly 20 years.
That's why, because I remember at my Sun Life days 10 years ago hearing about Healthcare Bluebook at that time. I think there was a Kempton group in Oklahoma City used you guys, and I was like, that sounds pretty cool, but I knew nothing at the time more about it. But so you guys have been around 20 years. I want to hear a little more of your story first, though, if you don't mind. We were talking about you grew up in Texas and UT Arlington and all that stuff, but why don't you really quickly recap a little of your bio? Pareto Health is the manager of the largest employee benefits group captive in the United States. And it's also now the main sponsor of the Self-Funded with Spencer podcast. I chose to partner with Pareto Health for three main reasons. Number one, their dedication to improving the world of health benefits. Number two, their mission to reduce volatility and to make self-funding simple for mid-sized employers. And number three, the strength and scale of their program. With over 2,300 member groups and more than $1 billion of stop-loss premium under management, Pareto Health is the most robust solution of its kind in the country, period. Stay tuned for more information because I'm sure I'll be featuring them on an episode of the podcast very soon. Visit Pareto Health at paretohealth.com or follow them on LinkedIn to stay up to date on the latest news and developments.
Yeah. So from Texas, been in and around the Metroplex most of my life, except for the 3 months I didn't live here. I lived in Shreveport once for 3 months.
Okay.
But other than that, and I live out in Arlington. And really in this profession, I'm everywhere, right? Okay. When you're a vendor rep, I office from wherever my territory is, and being in Texas is a great place to do that. So
is Texas kind of your territory, the state, or do you go outside the state as well?
It's kind of fluid, and I don't mean that specific to my role now. I mean, just in my career, you know what it's like. You work for a vendor, and your backyard hopefully is your main territory, and depending on other people on your team, your territory can shift a little bit. So always been Texas, the contiguous states, and then there are some others. I cover California as well, for example.
You do? Okay, all right. So are you on a plane a lot?
Yes. Now that all looks different, post-pandemic for everybody. I prefer in person. I think it's richer.
Agreed.
But the other part of me super loves the efficiency of just turn on the laptop and meet virtually. Yeah. But it's not as rich of a discussion or not as deep of a connection.
Yeah, that's the unfortunate thing, because I'm in agreement with you. The efficiency is the word I like to use. It is super efficient. You can get 8, 10, 12 sales meetings in a day with people across different time zones and different states. So if you're really good at that environment or that dynamic, you can be an effective salesperson and kind of exponentially increase your production.
Sure.
But you just can't build like super deep relationships over Zoom. It's why I do this in person. It's why I like in person. And I feel like if you do go travel to somebody and show the effort to get on an airplane and sit there knee to knee with them, they respect that as well.
Absolutely. Yeah. So I've been on the vendor side 15 years, and what you just said is very true. I've cracked into markets before where I've heard other people say they haven't had success there. I'm like, well, you have to show up. So Lubbock is actually where I was born. And it was a broker who used this term, calls it the Lubbock Mafia. It's like, you have to be here. You got to be from here.
I got told that too. Yeah.
Like, well, I get that.
Yeah.
People appreciate it. Respect is the right word for sure. But also people just like doing business with people they know and people they like. And, as much as I would love to say that happens while I'm sitting in my yoga pants and then, business attire from the waist up.
From the waist.
Yeah. You know what? Early on in the pandemic, I'm telling you a little secret here.
Okay.
So I would, of course, like everybody else across the world, you're comfy in the bottom, business on top. I would only fix my hair in the front. I wouldn't even do the hair in the back because I was on camera. I'm like, you know what? Curling irons are bad for your hair. So I'm going to preserve that.
So you just did the front. That's funny.
Just from the waist up and just from the front of the hair.
Hey, but I'm sure it was right in that frame. Everything in frame was probably perfect.
Yeah.
So that's funny. I actually had a different experience though, because I had a very little one at the time, just one kiddo, and I couldn't work from home.
Yeah, that's tough.
And then what my sentiment was, like, especially early in COVID when nobody really knew what was going on, I'm like, well, I could go to this office building where I'm one of two people that show up in an entire office building. I might actually be safer there, not knowing.
For sure.
So I would actually go in, I would conduct Zooms there, but I would, at least put on pants, do the back of my hair too. But how'd you get into insurance in the first place? So you're telling me a little bit of that story, but I always like to ask because I don't think there's only a few people that ever do it intentionally.
Sure.
We all end up accidentally getting here. So what was your entry?
Yeah, pure accident. So right out of high school, I worked for a PNC shop for about 6 months, hated it, swore I would never work in insurance. I'm still in college or about to start college, trying to figure out what I was going to do. Mm-hmm. Thought I wanted to be a college professor.
Really?
Yeah, and because I love teaching. That's my favorite part of my job now. It's why I write and teach CE. I like doing stuff like this. I love that part of my job, educating people. However, obviously I'm not a college professor, and it's because this pays better, and I still get to teach, and I get to do it, a little bit more de facto teaching. So a friend of mine and I worked in the same office building. He owned an insurance agency. Asked if I would work for him part-time, doing admin stuff. So remember, I'm still in college at the time. And I told him, absolutely not. I'm never working in insurance. Ugh. And long story short, I did do that my senior year of college for him and said, I have two conditions, Brian. You've got to hurry up and replace me, and I have to leave here in time to go watch Oprah every day. Those were my criteria.
When you told me that earlier, like, wait, like, how serious of an Oprah fan are you? Like, what was it about Oprah at that time that you had to be home to watch?
I don't know. I was like 19, 20. I don't know. I think she was the first person that I saw talking about well-being and really taking care of yourself in that way. I didn't grow up hearing about stuff like that. And, this was 25 years ago.
Well, as I say, pre-streaming, right? You have to watch a show when it goes on, right? So I think the kiddos these days don't realize that not everything's on demand whenever you want it. You used to have to go, I have to sit down. This was even pre-TiVo, so you couldn't record stuff. It's like, if you missed it, you missed it.
That's right.
And that sucks. So Oprah was your jam. Did you make it home every day for Oprah or no?
I don't remember. I ended up working there, though, for 10 years. Went from part-time admin stuff, and I was really good at operations stuff and process stuff. So I ended up working my way into being a director of operations there and hiring, sometimes firing, training our team on the life and health side, and talked them into buying a PNC side. It was a lot of fun.
Yeah, what kept you around though? Because obviously early on you're like, I don't ever want to do this, and then you stay there 10 years. Something must have changed. So,
and this is probably true with a lot of salespeople, I had a lot of autonomy there. And what I would tell people who came to work for me, for us, with me, was the funnest thing about that job, and kind of how my trajectory in this career has gone, has been not making the bed, so to speak, but building the bed. So he was a small agency. By the time I left there, I'd hired 11 people, but I was like his first employee, really. So that was fun. I was creating these processes and these roles and being really integral into shaping the direction of his company. He let me do that, and that was so fun. I treated that place like I owned it, and what I mean by that is that's how much I cared. That's how much of myself I put into it. But then I thought, I see my vendor reps just I just call them up. They come and pick up apps. What a freaking easy job. And they're all driving nicer cars than me.
Yeah.
You know, what did I know? So after 10 years, I left to go.
Was it really that simple? Like you just looked at the, like kind of the lifestyle, and I'm sure after 10 years, everybody maybe wants a change too, but like.
Well, there were some other factors in there.
Yeah, fair enough, if you don't want to go into it.
Well, I love Brian, the guy that I worked for. Still in touch with him, his wife, his family. Just had lunch with him not that long ago. But it was like brother, sister stuff. And I didn't want to work with him anymore.
Mm-hmm. That's fair. Everything at some point has sort of a natural sort of like, runs its cycle there. But so you got on the vendor side.
Yes.
I'm sure you're probably like me, pretty quickly realized it wasn't all as glamorous as maybe it
grass
looked
isn't
like.
greener. It's just different grass.
Yeah.
It's not that grass was worse. It was just different grass.
Yeah. So what were you doing at that time when you went to the vendor side?
So when you're new in the industry, at least back when I got into it, to be a vendor rep, they are buying who you know. Your Rolodex. Young people probably don't know that term either, but they want to know who you know. I didn't have a Rolodex. I had been on the broker side for 10 years. So I went to work for a small regional, fully insured carrier out of Detroit, Michigan, selling in Texas. And my job was brand awareness, creating a market footprint. This is when you could do group questionnaires, but with that carrier, you still had to do individual questionnaires. They were not rated. It was a tough sell. Okay. Unknown, individual questions, all this stuff. But they took me because they needed someone, and I wasn't going to get hired at any of the big names because I didn't have a Rolodex. Yeah. But that was fun for me too, because it was kind of like what I did at that agency. I got to create this territory. I got to shape how that whole process went, and was very successful there. And really have spent my career working for either products that are newer to markets or players who are newer to the market. Okay. And because I like doing the education and I like really helping build something, that's fulfilling for me. Yeah. And at Bluebook, it's a bigger company, but the brand awareness was what really attracted me, and what they accomplished truly. But what appealed to me is, okay, now I've got resources of a little bit of a bigger company, so I'm not, building the bed from scratch, but it still has that small company feel. Yeah. And still nimble. And, you asked me how long Bluebook's been around, nearly 20 years. We've been doing cost and quality transparency before it was cool, before people were talking about transparency in this industry.
Well, like I said, you guys were the first name I ever heard in that space, and I was even still 10 years late to the party. Where is Healthcare Bluebook based?
So headquarters are in Nashville.
Okay.
And I'll be there next week or the week after, actually. And for those of you who didn't know, I'm out of the season of life where my friends are getting married. I'm not going to weddings every other weekend. But, boy, I have learned Nashville is quite the bachelorette hub. So you know this.
How do I know this? Well, we obviously have one of our captives is a Nashville-based captive. We're domiciled in Nashville as well, so we do our members meetings there. And we go there for other events too, and it's just like, oh my God.
Are you crashing bachelorette parties, Spencer?
No, but you go out. We obviously go out every time we're there, and there's a bar that one of our captives is named after, and it's a hole-in-the-wall bar that has like super fun. It's like a college bar, but there's always somebody playing music because it's Nashville. But you go out there, and it's like this particular one has an open window to the street. Yeah. So you can kind of hang out, and you just see bachelorette party after bachelorette party. You walk.
Yep, you're seeing the sash.
And it never stops. That city is like a mini Vegas almost. I guess Nash Vegas is what they call it. But oh my God, the nightlife there on Tuesday is off the chain.
You know what? I've always been an old lady. I was born an old lady. Okay. My best friend, even when I turned 25 forever ago, she got me this card, and it was a picture of a grandma. It was like a happy birthday grandma card. Nightlife is great until about 9. Yeah. And I'm done.
Yeah, that's the same. Yeah. Yeah, like I get dragged out to things, and then I'm the guy that does the Irish goodbye and just like disappears. And like, wait, where's Spencer? Like, I'm in bed. But so I want to ask you before we move on to like fully Healthcare Bluebook, in the vendor side now. Obviously, you've been here a long time. Is this where you feel is home for you? Like,
love it.
Okay. What is it about being a vendor rep or a carrier rep or things like that, selling to brokers, that you enjoy?
So you mentioned part of the reason you don't think you'd want to be a consultant. So along that same line, I like being on the vendor side because a couple things. I like the autonomy. I've worked remote for the last 15 years. So that's great. But also, I like to work with the consultants. They all think very differently from one another. So part of the fun for me is figuring out what is it that I can offer you that's going to help you with however you're thinking about helping this client or whatever your mindset is. Then I get to do that with their clients and prospects too. But also, as hokey as it sounds, I want to make a difference. You know, that's a total pageant answer, but it's the truth. And I feel like I get to do that. And when I've mentored people, I've told them, you need to sell your company, then you need to sell your product, but first you got to sell yourself, right? So I just want to get in there and help people. I like to educate people, and I get to do that and become a subject matter expert. So before Healthcare Bluebook, I spent a lot of time doing consumer-driven product stuff.
Okay.
And if it was an acronym, I probably taught a CE on it.
Okay.
But then I realized with HSAs, for example, I sold a ton of those. I'm really not impacting change. I thought I was when HSAs first came out, like, okay, I can see where this is going. I like the concept of consumerism. That's actually how I learned about Healthcare Bluebook when I was on the broker side.
Really?
Healthcare Bluebook was going to be a tool that I wanted all of my employer groups and employees their employees there to understand. Like, use this cost comparison tool to stretch your HSA dollars. That's how I first learned of Bluebook.
That's interesting.
But with Bluebook as it is today, out of anything I've ever done in this industry, my whole career, this is the first place I've ever worked where I can tell you and see an immediate impact to the member, to the plan sponsor, and that is super fulfilling for me. Super fulfilling.
Well, so great segue into it. I mean, the passion obviously is palpable here, and you talk about it. I want to say this, though, the sentiment that you just described, I do agree. Like, I like to be able to tell a story to consultants, have kind of a worldview. I believe in what I sell. Whenever I go to these organizations, I vet them, I validate them, I make sure I want to be there and have my name attached to them. But you have a level of sort of influence on sort of a broad-based opinion. So like, if you do have great relationships with consultants and you're able to bring them around to your worldview, because again, the thing that you're providing is valuable, now they're going to go disseminate that to their clients and their prospects, and that's how it trickles down. So I like that, right? There's a lot of sort of the story of, that you're telling as well. And you're, like you said, you derive credibility as a person with them so that they trust you. When that is a big part of what we do. But I want to now segue into Healthcare Bluebook, and I saw when you were describing, I knew you meant it, but like, what are some of the types of things that you see? Like, give me an example of something where I made an impact here.
PlanSight is a complete game changer in the world of insurance brokering. As a broker, you know how time-consuming and error-prone the traditional RFP process can be. Well, what if I told you there's a better way? PlanSight is the only end-to-end RFP solution on the market made specifically for benefits agencies. It's like having a superpower that gets you an average of 8 to 10 hours back per employer renewal per year. And the best part? PlanSight supports all carriers, all funding types, and all group sizes for over 20 different benefits. If you're ready to make your RFP process faster, more efficient, and more profitable, it's time to call PlanSight. Visit plansight.com now to book a free demo and discover the future of insurance renewals.
Okay, I appreciate this question. So I'm going to answer it. I'm going to give you a long answer.
Please, yeah.
I'm going to give you a couple. So, and it's also going to help explain what the heck does Healthcare Bluebook even do. So we've been around 20 years. I said we do cost and quality, transparency. What does that mean? I spend 90% of what I do is still educating brokers, consultants, employers on what does that mean? How is that solving for anything that I'm trying to do? Well, everyone wants to reduce cost. I mean, you know that. That's why you like self-funding. And there's so much creativity, and there's so many ways you can parse that for an employer to make things work for them to hit their initiatives. Well, all that to say, I'm going to give you two anecdotes about Healthcare Bluebook that talk about the impact that I see and explain what is it. So I said we do cost transparency. All right. So let me give you an example. My other half, his name is Kevin. In March, he needed to have an MRI on his shoulder. How would you, and I'm kind of leading you here, how would you go about figuring out where you're going to need an MRI if your doctor tells you you need to have an MRI?
Okay. I don't know, other than, usually typically they would recommend, hey, go down the hall. I know enough now to go, whoever they recommend, they're probably getting some sort of referral fee, and it's probably going to be outrageously expensive. So I would shop a little bit. To shop a little bit, I'm not sure what tool I would use at my disposal right now.
Yeah, and you're right. Especially here in Texas, we have so many physician-owned hospitals, and that can be a good or bad thing. We have so many physician-owned imaging places. So it's like, is that a conflict of interest, or is that helping me? Who knows? Well, so with Kevin, and the way you answer that is perfect, because people don't know to shop. The fact that you would shop at all, that's because you're in the industry.
Yeah.
Most people don't even know
I'm
they
only
can.
intelligent enough to know that I can shop. I'm not intelligent enough to know what tool I would use.
So let me tell you how this went down with Kevin. Now, where he works for a school district. They don't have Healthcare Bluebook, but I love telling this story because he's not an expert in this industry. And the way he was asking me questions, I'm like, this is exactly how a lay person experiences healthcare. So he shoots me a text and says, I need to get an MRI. The doctor's going to send me to Envision Imaging. Okay. And I wrote him back and said, don't go to Envision Imaging. Now, mind you, I went to Envision Imaging myself for a mammogram, for my own shoulder MRI, before I worked at Healthcare Bluebook. Being in this industry, I didn't know how to shop either. So where my doctor recommended, that's where I'm going to go. They're in my network, okay. So I told him, they're overpriced. And a picture is a picture. An MRI is an MRI. There are different kinds of MRIs, yes, but there's not a health outcome to getting an MRI. It's just pure cost, okay? So I told him they're too much, and he said to me, and he wasn't challenging me. He was really curious and trying to understand. He's like, well, how much different could it be, one place to the next? Like if you go to buy a box of Kraft macaroni and cheese from Target, Tom Thumb, Kroger, they're going to be relatively close in price. There's going to be a little variance, but not that much. It's the same no matter where you go as far as the product. Healthcare, we're talking about a huge spectrum in cost here. So I said, I tell you what, you tell me when they let you know how much it's going to cost you. Where he works, $5,000 deductible is what he has.
Okay.
So the next day he texts me and he said, I'm just going to go to Envision Gentry. It's going to be $3,800. My doctor's already got it set up. That's who they use. Path of least resistance.
Yeah.
I said, okay. I just went to Healthcare Bluebook's demo site, typed in Kevin's zip code, shoulder MRI. And I said, we use traffic light iconography, so red, yellow, green, super simple to understand. I said, Envision, it's red, because I know it's overpriced. I said, go to this one. And I sent him, or suggested that he go to North Texas Imaging. It was green. Any guesses on what the MRI cost him there?
So you said $3,800 was the other one.
With his insurance. That was in-network insurance.
Okay, so my guess is $600.
$400.
$400, okay.
So by using our tool, I just went to the employee-facing, demo site. Instead of him paying $3,800, he paid $400. Okay, and they're close to each other, a couple miles apart, so it wasn't any less convenient.
Yeah.
Now, what would that have looked like if he had been a Bluebook member, a Healthcare Bluebook member through his employer? Well, I'll tell you. Let's say he still decided to go to Envision. Path of least resistance, he's not reading our communication material or whatever. He still just does that. Okay, then he would have gotten what I refer to as our love letter.
Okay.
It's not a love letter, Spencer.
I guess that.
It's a missed rewards letter. So it would say, Kevin, we saw you recently had imaging done. Don't forget you've got this tool. You can use it on your phone. You can call us. You can chat, whatever you want to do. And we could have saved you $3,400. And we would have incentivized him to use the tool. He would have also gotten a $100 reward for being a good steward of the plan. So we would have saved him $3,500.
Right.
When people get that letter, they're 4 times more likely to use the tool before their next planned claim.
Yeah.
Now, why is that important in this example? Let's say, this was not the case for him, but if it had resulted in him needing to get a surgery for his shoulder, if he had received that missed rewards letter prior to that surgery, chances are he's going to now use the tool. Well, heck, I just cost myself $3,500. Now I've got to have this, torn labrum repaired. I'm going to look at the tool. So that's going to lead me into this next example. When we're talking about procedures like surgery, your out-of-pocket's going to be whatever it's going to be.
Yeah.
As a member, I'm not necessarily concerned with saving the plan money. I don't care. to be truthful. If my deductible is going to be the same, my out-of-pocket's going to be the same, but I dang sure want to make sure I'm going to have a good outcome from that surgery.
Yeah, yeah.
So I'm going to ask you again, another question.
Put me
putting
on
you
the
on
spot
spot.
again. Yeah. Okay.
If you were told you needed to have a knee replacement, let's just use that as an example. You've got some pain, you go to the doctor. How do you pick a doctor? How do you think you'd even go about picking?
For like a knee replacement?
Yeah, or anything, but we'll just use that.
But so presuming, obviously, I've got the scans, the recommendation from my doctor says you need surgery. Again, probably follow his or her recommendation. I mean, I trust that authority in the white lab coat, right?
They're in your network.
They're in their network, yeah. They're just down the street. They're convenient.
Yes.
My neighbor said that's where I got my knee done.
Yes.
Yeah.
Okay. I love that you just said that. This was not planned. So early in 2020, before I worked for Bluebook, I had hurt my shoulder. It had been bothering me for like 8 months, actually. I'm a side sleeper. It hurt, woke me up. So pandemic, you remember early on, we're all 6 feet apart, right?
Yeah.
So I see my neighbor Gerald across the street checking his mail. Like we're still trying to figure out pandemic world. It's that early on.
He's on the curb and you're on the curb. Yeah,
exactly.
Yeah.
So I see him checking his mailbox and he's got his arm, like there's this big contraption. I'm like, hey, you okay? He had a shoulder procedure done.
Okay.
So this is how I picked my orthopedic doctor. Who did you go see? Dr. Daniels. Where's that? He tells me. You like him? Yeah. Is your shoulder better? I think so. That is how I vetted my doctor.
Yeah.
Well, what Gerald needed and what I needed were completely different. So had I had Bluebook, it would have been different. So let me give you this other example about quality. Okay, we talked about cost. That's one part of the equation.
Yeah, and I want to at least comment on the fact the MRI, the outcomes are going to be the same, right? An MRI machine is effectively an MRI machine. You're not talking about a huge difference in potential outcomes going one place or the other. Really is just the cost that you're choosing at that point, right? Surgery is a different ballgame altogether. So now you're going to think about the quality of outcomes, the revision rate, complication rate, things like that. So I just wanted to touch on that because I'm glad those two examples are juxtaposing one another here.
Yeah, thank you for also clarifying. So I'm going to give you another real life anecdote. My Aunt Teresa was the first person in our family to be diagnosed with breast cancer. This was nearly 2 years ago.
Okay.
I'm going to walk you through how Bluebook impacted her. So with Kevin, we know we saved him $3,400 off his deductible in real life.
Yeah.
Now, with my aunt, she felt a lump, and I'm a little bit passionate about breast cancer prevention because I've been personally affected by it before my aunt, but just not in my family. It's with friends. So she felt a lump. She got a mammogram. It was suspicious. She was scheduled for a biopsy. Now, I want you to pay attention to this timeline.
Okay.
Her biopsy was scheduled on a Friday afternoon.
Okay.
Monday morning, the following Monday, she gets a call. It's not like TV where you're sitting in a fancy doctor's office with great lighting and they hold your hand and tell you have cancer. It's not like that. She gets a call. You have cancer. You have breast cancer. Her questions were, first of all, I'll tell you she's okay now.
Good.
But the way this played out is exactly how so many other lay people experience healthcare and health insurance. So she's on the phone. She's being told she has breast cancer Monday morning. She says, okay, well, what stage? They said, well, we don't know the stage. You need to have more testing for us to know that. Okay, well, when are we going to schedule the testing? Well, you need to go to an oncologist for that. We're not oncology. Well, who do I see? Well, we'll call you back by Friday. We can give you the names of some oncologists. Give us till Friday. This is Monday morning.
Okay.
Now, that doctor's office, they don't know health outcomes of any oncologists. They're going to just use their own resource. Who in this healthcare system do we know treats breast cancer? So 2 things happened that same day. My cousin Samantha, she's in her 30s. She has an MBA, business owner, super smart. But even more importantly, can I see your phone for a second?
Yes, you may.
I'm not gonna go through it. MBA aside, business owner aside, she's over 2 years old, so she knows how to use one of these.
Yeah.
So what she started doing after her mom was diagnosed, she was crowdsourcing. Like you just said, you ask your neighbor.
Yeah.
So she goes to social media. She's making calls. Who do I know in Lubbock that's dealt with breast cancer? Where did you go? That's her path for that Monday. And my path looked a little different. I'll touch on it in a second. She came across a website. I think somebody sent to her this link top 30 breast cancer specialists in Lubbock County.
Okay.
I didn't even know Lubbock had that many.
Yeah. Yeah.
So she's going through, clicking names, trying to see where, they treat people, learning what she can. Getting pretty frustrated and a little scared because as she's doing this, Spencer, 24 of 30 on that list didn't even treat breast cancer. They treated other kinds of cancer.
Okay.
So it's a bad list.
Yeah.
You ever had the experience of looking for a doctor, trying to find a specialist, and you see them listed in the network directory online or something, but you call and they're not actually in the network or taking new patients?
Yep.
So same kind of thing.
Not to mention, I look at those lists. Like, you ever sit as an airport or somewhere where there's like a periodical, it's like a Dallas magazine, and it's like the top 30 surgeons in Dallas on XYZ. I'm like, that is the top 30 surgeons who paid to be listed in that magazine, right?
Yeah,
I'm very skeptical that that's actually the case. Or who's making that judgment?
I have picked a doctor out of D magazine.
Yeah.
5th year in a row. That just means they filled out some application.
Right.
So back to Aunt Teresa. So my cousin's going through social media and crowdsourcing, trying to figure out where to go. My aunt and uncle are waiting for her doctor to call her back. I'm like, this is my wheelhouse. No, even when I tell my family what I do, no one can understand. What do you mean you do cost and quality transparency? So I said, look, this is how I'm going to help her. So that same Monday morning, I hop on to Healthcare Bluebook.
Yeah.
And I don't know what kind of treatment she's going to have, but I know breast cancer. Well, okay, what are some treatments for breast cancer? What are some treatment types that you may think of?
I would think of chemo, right? Mastectomy, unfortunately, some situations. That's all my two guesses, right?
Okay, that's great.
Okay.
So that's what I did. I started searching chemo, Lubbock, mastectomy, lumpectomy.
Yeah.
And I realized, okay, I still don't have enough information. This isn't helpful. So I called her back the same morning that she's diagnosed. And I said, Aunt Teresa, I know you don't know for sure, but do you have any idea where you would probably get treatment? We didn't know what kind of treatment. We didn't know what stage. She said, and I loved the way she was thinking. She said, well, my doctor is at UMC. Uncle David's cardiologist is at UMC, so maybe UMC. So then I start looking up those terms on our site, just like an employee would, at UMC to see what kind of health outcomes that facility was having.
Right.
And traffic light iconography, remember?
Yeah.
Red, yellow, green.
What color?
Red, yellow, no green.
Yeah.
But I can see
And now, was this on cost or quality?
I'm looking at just quality.
Quality. Okay.
Because if someone's going through cancer, first of all, they're hitting their out-of-pocket.
Yeah, they're not as worried about cost.
Yeah, it's going to cost them the same whether they get good treatment or not.
Okay.
Though we will show the cost. So I'm focused on quality, and I'm seeing these oncologists here that can do all of these things at UMC. But by clicking on them, I see they also have admitting privileges to another hospital called Covenant.
Okay.
So I click in there. Green, yellow. I'm like, okay. So I called her back. And I said, Aunt Teresa, I've got the name of 4 oncologists for you. Call your doctor back, the one who told you you have breast cancer, and see if you can get into one of these oncologists. I said, but here's the thing. You can have these treatments, whatever that may be, we don't know yet, at UMC, like you're thinking, but I don't recommend it. Why? And I explained to her, look, red, yellow, I explained all of that to her. And she asked me such a good question. She said, well, let's say I go with Dr. Shalaby, for example. It was one on the list. You're telling me that if Dr. Shalaby does my mastectomy, if it ends up being a mastectomy, at UMC, it's going to be a different health outcome than if Dr. Shalaby did the same mastectomy, but at this other hospital? And I said, yes. She said, why? Same doctor, same treatment.
Right.
And I said, that is a great question. One I had never thought to ask prior to doing what I do. Do you know the answer?
Well, I'm thinking infection rates or hospital-acquired infections, maybe. I see you nodding. Is that one? Maybe the anesthesiologist might play a role, but that's probably not right. What else? I don't
You're
know.
on the right track.
Okay.
So different facilities, and they could even be in the same healthcare system.
Yeah.
Maybe it's Baylor McKinney versus Baylor Frisco, Baylor Dallas. All Baylor, you're going to have different outcomes potentially, even if it's the same people, same treatment. Here's why.
Yeah.
You've got different staff. You've got different nurses, you've got different anesthesiologists, they've got different safety protocols within the letters of the law, of course, different levels of experience, different caseloads. It's not just Dr. Shalaby, who is part of your care. So you can have the same provider, same treatment, 2 different locations, different outcomes.
Yeah.
So all that to say, before or by that Friday, she was actually sitting with her new oncologist, meeting him for the first time, instead of waiting on a phone call from her doctor
Right.
to be given a name based on nothing, really.
Right.
So after she went, she had a bunch of tests done. Turns out stage 4.
Oh, man. Okay.
She ended up needing a single mastectomy, chemo, immunotherapy. That will be for life. So then my cousin calls me. This is, weeks in, with another really good question. And she said, Gentry, do we need to be taking my mom to MD Anderson?
Okay.
That's a great question. We know that's a very well-respected cancer treatment hospital. It's also 8 hours away from where they live. But you find out your mom's got stage 4 breast cancer, we'll go to Houston.
We'll go. Yeah, absolutely.
So I hopped on our system. I typed in single mastectomy, MD Anderson. You want to guess the color?
It'd have to be red, right?
It was yellow.
Yellow, okay.
That's okay. It's average outcome.
Yeah.
But this gave the family peace of mind.
Yeah.
Because God forbid, my aunt is in remission. We just learned this a couple of weeks ago. But had things gone a different way, if she had passed away and had not gone to MD Anderson, then the question would be in our minds, did we make the wrong decision?
Right.
So gave peace of mind, helped her get into an oncologist quicker than she was going to otherwise, and helped pick the facility in Lubbock that had the best health outcomes for the exact treatment she needed.
Yep.
So when I talk about Bluebook making an impact, whether it's financial or to the results of a treatment, there are 2 right there.
Well, so what I'm hearing, and these are fantastic stories. I love using story to tell about what you do, because it gets too technical sometimes and you lose people. But what I'm hearing is there's a lot more intelligence added into every step of the way. So the cost and quality, but I can source information I need in an intelligent way that's got substance and evidence-based, and it's got lots of credible data. I'm sure the data set is big enough to be credible. So it's not just some network of telephone and guesswork and Google searches and things like that. And what I'm thinking about is something maybe that you didn't mention that might actually add to the possible positive outcome is a placebo effect. Guess what? I trust, it's got a green outcome. They've done a bunch of these. I'm going to go in and go, I think I have confidence that this is going to work. And so what impact would that play on my recovery or my faith or my sentiment going into the surgery, knowing I'm going into the best rated doctor in this category? I think I'm going to be all right. Like that would fuel me, right? That would give me hope going into it. That's something that you guys provide, maybe even indirectly.
So peace of mind is huge.
Yeah.
And, I'm glad you brought that up, because that's part of it. Sometimes when I work with employers, it's all about the bottom line.
Sure.
Look, cost containment. We trust that their network's got good doctors. I mean, they're board certified. They're part of this carrier's network, so surely they're good. No. When you have a centers of excellence, for example, that's a facility usually, and it's designated, let's say, by a carrier. So you think, hey, I'm going here for this particular treatment. It's a center of excellence according to my carrier. I know I'm getting good. I'm going to have a good outcome. Well, what is that based on? That's based on and I'm oversimplifying it here, but that's based on all of their physicians, all of their medical staff, all procedures. Well, you may say, well, that's not true. You can have a centers of excellence for cancer. Okay. Well, not all doctors are going to be created equal within that, right? Sure. So all that to say, you have to really look at the provider and the facility separate for the reason I just gave you with my aunt. And then you need to look at the exact treatment, because let's say Dr. Sorensen in Dallas does great total knee replacements. That may not mean he does great ACL repairs. Who knows? Well, we do, because we've got the data, and we can, another time talk about sourcing that data. It's got to be credible.
Yeah.
And then the other part of it is it's got to be real-time data. I don't care what was the cheapest MRI 3 years ago or even 18 months ago. I need to know now.
You're right.
And same thing with outcomes. Just because I told you when my aunt was going through this that MD Anderson had average outcomes for single mastectomies, maybe that's different today.
Sure. Yeah, that's not to say it's static, right? People
Not
can
at all.
improve, or it could get worse, unfortunately,
Yeah.
over time as well. So yeah, and I don't think we need to go in deep in the weeds of like how the data is sourced. And I'm sure when you have sales conversations, that comes up.
Sure.
But I do want to move from that narrative to like, let's ask a few questions that are more technical in nature, because I presume people that are listening to this point go, this is interesting. I want to know more. Yeah, and please grab your Topo Chico. So let me ask you this, like kind of the who's it for. I like to always ask, well, who's it for? What type of employer? What type of group sizes? Like, give me kind of the brass tacks of the sales conversation when a consultant's trying to identify who's a fit for what you guys do. What do you look for?
Yeah. Thank you. I appreciate the
Yeah.
question. So it's not going to be size or industry. They have to be self-funded. There are very few exceptions to that. And the reason is for us to verify and validate claim savings, we've got to have a claim feed.
Okay.
We're not going to get that from fully insured
Right.
carriers. And then also to deploy communication, engagement, reinforcement, curated messaging, we've got to have an eligibility file.
Okay.
So we get that from the self-funded carriers and TPAs out there. The other thing that we do is plan design integration. We
Yeah.
can't do that with the big carriers.
Okay.
They're not going to play that game. More progressive TPAs or TPAs just in general are more willing to do that. So what that looks like is, let's say you've got a TPA that says, okay, we're going to embed utilizing Healthcare Bluebook into the plan. So members, if you go to a red provider, a red facility, you want to overpay for care, you want to get subpar quality outcomes, go ahead. You're going to have your standard deductible and coinsurance. You want to go to a green, fair price, best outcomes, then depending on the plan design, maybe we wipe out your out-of-pocket altogether.
Yeah. Well, didn't you say you can go so far as even maybe incentivize them with a check or something to that effect as well?
Yeah. So before plan design integration, that's really where things have been headed the last 18 months, 2 years. That's what we did. So in the example I gave you with Kevin, had he been a Blue Book member, shopped for that MRI, yes, he saves on the deductible, but he would have also received a $100 cash reward.
Okay.
That can range up to $1,500 for a joint replacement,
Okay.
sticking with the total knee example, for example. Yeah, that incentivizes people. You tell me, go here, you're going to have a better outcome, and we're going to send you $1,500. Okay.
Yeah.
But let me tell you a question you didn't ask, but one that comes up a lot, and that is, I've been seeing Dr. Sorensen for 15 years. I don't care what your little tool says, Gentry.
Yeah.
I'm going to...
Your silly little tool.
Yeah. Okay, well, moving people away from their doctor isn't usually what happens.
Yeah.
It's the facility.
Okay.
That's where there's the most variance in cost. We can have that variance in quality. You want to keep Dr. Sorensen, but he's got privileges at Presbyterian and Baylor. This one's cheaper. They're both in your neck of the woods. Go to the one that's cheaper. We're going to send you $1,000.
Yeah,
So
yeah.
the incentives definitely work.
Well, I like though that it's also structured in a way you're not punished per se by choosing a red facility or a red doctor. You're simply just paying what you normally would have paid
Exactly.
otherwise, right? So what did you call it earlier over coffee? A carrot flavored stick? Or
Yes.
carrot flavored stick. So I like that because it's not necessarily a punishment. It's not a mandate. But when you put it all together, it's like, who would choose this? Like, if you're choosing this, you're just kind of stubborn at that point, right? Or there's something really going on that's making you make this decision. Okay, you still have just your normal deductible, your normal copays and things like that. Great.
Yep.
Cool. So I like that. It's not too severe either way, but there's enough incentive that you can change behavior. And really human beings respond to incentives. I talk about this all the time, but it's like, here's a way to structure an incentive that everybody wins. The member wins, the plan wins, the doctor, is now receiving potentially new patients because of their quality metrics and things like that. That's great for everybody. That's great for the system as well.
Yeah. Yeah, you're right. In along those lines, you were asking me, who uses Blue Book? Who's your audience for this? So employers, self-funded, and those maybe you've already had a lot of change in plans or carriers or point solutions, and there's point solution fatigue, or I just don't want to disrupt the plan. I don't have the bandwidth to make changes for my company right now, whatever that may be. Well, with something like Blue Book, we simply look within your existing network or your existing formulary, because we do this cost and quality stuff on the pharmacy side too. So what I mean is, you don't have to change carriers, you don't have to change networks, you don't have to change formularies, you don't have to change PBMs. We're going to help you optimize what you already have, Mr. Employer or Mr. Employee. So no disruption. We're just helping you optimize what you already have available to you by helping you see where you're going to have the best outcomes or save the most money. And I bring that up because disruption is hard for everybody.
Sure.
It never goes smoothly. I mean, I've been doing this 25 years. How long have you been in the business?
Insurance in general, about 16 years now. Yeah.
So you've seen it.
Yeah.
I mean, implementations, there's always ups and downs. There's no disruption to the member or to the plan.
Is this something you can bolt on mid-year, or does
Yeah.
it have to wait for open enrollment? Is there anything that, like, from a plan doc amendment or anything that's required? And so how do you know, like, is this TPA going to be great to work with? I mean, I know you guys probably have a list of ones that integrate well, but I'm certain, like, not every TPA is created equal as well, right? So, like,
Exactly.
you're identifying their existing vendor relationships and making sure everything's going to work and things like that?
Yeah, I mean, there's some stuff on the back end that's got to be vetted on both sides as far as data integration. Claim adjudication, all of that stuff has to happen for sure.
What's a trigger, though, that you guys get notified? Like, so that you said you had that TPA feed. Is it pre-certs and things like that? Or how is Healthcare Bluebook, unless a member goes in and logs in to search on their own, intervening maybe on their behalf or proactively?
ClaimDoc is a medical claim auditing and member advocacy company. We provide fiduciary services to employer-sponsored benefit plans, and allowing them to create an environment where we ensure that the benefit plans are being charged in a fair and reasonable basis.
My business is basically people, and it become a real simple transition. We thought it was going to be far more complex. I've saved, we'll say, hundreds of thousands of dollars. I could not say enough about ClaimDoc.
So when we get the claim file, so we're seeing that. That's how we're validating claim savings.
Yeah.
But beyond that, what we do is curated messaging. So
Okay.
what the heck does that mean?
Yeah.
Well, Spencer, you and I are roughly the same age. So we're the same demographic. That way, you're a man, I'm a woman. So if we sent you stuff on mammograms, that doesn't really mean much for you personally. It might, for your wife or something, but so when I say curated communication, that's going to be based on demographics. It's going to be based on your claims history. It's going to be based on your searches. So you've got little kids. Maybe we've seen, you or your wife is doing searches for ear tubes, or we're seeing come across your claims lots of ear infections.
Yeah.
Then we might do a campaign with you around ear tubes. Not telling you to get them for your kiddo.
Right.
Just letting you know what the options are available, who in your area.
Just kind of prompting and reminding that we're here, right?
Yeah.
I mean, because a lot of this comes down to communication, awareness. You said that love letter that gets sent, there's 4 times as likely to do it on the next go round. It just makes sense. Sometimes people just don't know these things exist or need to be reminded. They forgot. Maybe they couldn't find the original pamphlet that was sent out,
Yeah.
so whatever the case may be. And so continual sort of prompts, but you're saying you actually even tailored it to the individual.
Absolutely.
Right? That's cool. Okay.
Yeah, because if I receive something on ear tubes, that means nothing to me. I don't have kids.
Yeah.
I don't need ear tubes. So we want it to make sense and be at the right time that you're receiving education materials. So we do that. We also do gamification, which I love. I'm going to make you play this game with me. So, you mentioned in good memory, when people get our missed rewards letter, they're 4 times more likely to use the tool. Great. Well, we don't want to miss them. We want to catch them before that, right? So gamification, super popular in a lot of businesses, ours included. One of my favorites is The Price is Right. So we've got a game where we've got a member, you're new to Bluebook, we send out a communication piece, play this game. All of our games solve or answer 3 things. Who is or what is Healthcare Bluebook? What's in it for me? Why do I care? All of our communication answers those questions for you. So with the Price is Right game, we'll send you a link. And the first question is something like, Spencer, do you want to pay $3.50 for a gallon of milk or $35?
$3.50.
All day long,
Yeah.
right? So then maybe we'll do one about eggs or gas or something else. The third question links you to your landing page.
Okay.
And now we say, let's do this, but with medical stuff.
Okay.
So you can put in any procedure, any prescription, whatever it is, your zip code, and you can see that cost variance that exists in your backyard.
Okay.
When people play our games, and they're quick, they take like a minute, they're 11 times more likely to use the tool when they have a planned claim coming up.
Yeah.
So we catch it on the front end.
Well, think about it. You were talking about the layperson earlier. Think about it. If I know, hey, I've been recommended for a knee replacement at some point. The doctor says I'm trending towards there. At my age, I'm probably going to need it. Well, if you took me to a game that showed me the variance in knee replacement costs in my area, I'd go, what?
Yeah.
How, is that possible? How is it I can pay 10 times as much over here versus over here? Is it a different knee? Is it a AI-powered knee? Like,
And
what
it
the
can
heck?
even be the same doctor doing the same procedure, 2 different buildings. So let me ask you.
They probably they go, whoa, I had no idea that was possible.
And more than that, even if they understand that, do they care? No, their out-of-pocket is going to be the same no matter what the plan is paying. But if we pay you $1,500 because now you're going to go to this fairer price facility, keep your same doctor if you want. So let me ask you this. We've talking about knees. What do you think the average cost is for a total knee replacement around here?
Around here? 40 grand.
You're close.
Okay.
It's about 50.
Okay.
What do you think the range is for a fair price? And I'm talking about paid claims, based on actual paid claims.
The range from the cheapest to the most expensive that you've seen. I'm going to say 20 on the low end. I'm going to say, I'm just going to pick $140,000 on the high end.
You're really good at this game.
Okay.
So about 20,000. I think it's a little less, like 19 and change.
Okay.
So you're right there.
Yeah.
And then right now, in today's actual paid claims in this area, based on millions of in-network claims, 126,000.
126 grand.
Yeah.
Okay.
So that's the variance, $20,000 to $126,000.
Yeah, so 6.5 times variance almost. Okay.
Yeah. So if we can move a couple of procedures like that for an employer, that adds up.
Well, see, I want to comment on something. Member doesn't care.
They don't.
Agree. But here's why they should care. One, they're being incentivized properly, which I like because that overcomes their lack of care or their apathy. They should care. Because the outcomes, and you and I both know this, your premiums that you pay, the cost of your health care is a function of the claims themselves. So if we, collectively as an employee base, alter the course of claims 10 to 15 to 20% in a year, well, guess what's going to happen next year? My premium's at the very least going to hold, if not possibly go down, or I'm going to get a new benefit or a premium holiday or whatever. So I used to be of the mindset, don't tell your employees that you're self-funded, doesn't matter. Now I know what I know. I would tell them, and I'd tell them why they should care and incentivize them to care. Because at the end of the day, the plan benefits, they all pay less money.
I agree with you. So you had something on LinkedIn the other day I saw, this EKG effect.
Yeah.
You know, the highs and lows of claims, whether it's monthly, annually. So that's a place where Healthcare Bluebook immediately can start compressing those claims costs because people are being better stewards. They're incentivized to do it. Something else that I get asked a lot, though, is, well, who says that's the best outcome? You know, I'm skeptical if my employer is telling me I've got this tool that's going to tell me where I should be going. Well, you can go wherever you want, no penalties, as we said. The outcomes that we're looking at, like with breast cancer for my aunt, it's objective data. This is not your employer's opinion. This is not your carrier's opinion. This is objective data based on a bunch of stuff, you know, we can talk about it another time. But what kinds of things are we looking at? You mentioned one earlier, infections, complications, mortality, unanticipated readmissions.
Yeah, readmissions got to be one of them,
Yeah. So we're looking at not patient satisfaction. That's nice. You want to know, is my doctor nice, easy to get into? But that doesn't tell you how effective that knee replacement is going to be for you. These outcomes, these health outcomes, these quality scores are telling you that doctor at that facility doing that exact procedure has this outcome. So I bring that up because sometimes people are curious, like, are you sure this isn't benefiting my employer someplace? You're not just sending me to the cheapest place for my employer? No, we're going to tell you objectively the good, the bad, and the ugly. You can do with it what you want. There's no penalty.
I mean, I understand that skepticism, but do you also think employer cares so little about you that they'd send you to the worst possible doctor because it's the cheapest? I mean, do people think that? I mean, I suppose some employers might be that unscrupulous, but I wouldn't go work for a company that I suspected that's how they viewed me.
You know what, Spencer, you wouldn't, I wouldn't. Not everybody has that choice.
That's fair.
But I'm
Okay.
also talking outliers here.
Yeah.
Because we know we've got some employers are super paternalistic. They're holding hands through everything for every employee, insurance and beyond. And then you have others, hey, just be in the back, pushing out, the cogs on the wheel. It's all about cost. So those are two different mindsets of employers.
Yeah.
And most fall somewhere in the middle.
Yeah.
There's a bell curve to everything. So, yeah, I don't think that most employers are so unscrupulous to just drive the dollar.
Yeah.
But, some employees, they don't have the choice. They just need a job that they can get to. It's going to provide some income, and maybe they're not working for one of the best. But that employer will still benefit from Bluebook if they are focused just on cost containment.
Absolutely. Well, but I think when you layer in the quality, right, that removes some of that skepticism. You combine those two, then that's going to improve the overall, outcomes themselves, right? And so it's not just did I save money in this singular instance, but the long haul productivity of that employee, their quality of life, their happiness, their desire to stay with this company, all of those things will factor into making them a better employee as well, and a happier employer. And I think that's probably an indirect, but maybe a not so indirect, part of the whole equation as well. So let's kind of move towards the end. I think this has been really fun. I love the stories that you told, because it really helped me understand better what you guys do. But you've been into this industry a long time, like I have. Are we going to solve it? Are we going to fix it? We're doing okay? Is it going to collapse? What do you think?
I was listening to a podcast the other day. It was a true crime podcast, and it was talking about the war on drugs, and this DEA agent or whoever was saying, we can fight this war, but the analogy he gave was, have you ever stood in the ocean, just ankle deep, knee deep, waist deep, and tried to hold back water?
Yeah.
You're not gonna hold that water back, but we still have to try. And I think we've had a lot of innovation in this industry. It's certainly gotten more complex. Are we going to solve it? There's no silver bullet. There's no magic bullet, but there's so many creative, cool things out there that can really make a difference.
Yeah.
Like with Bluebook, we're not changing your plan. We're helping you use your plan better. Mm-hmm. So we are one part of this macro system. Mm-hmm. So no, I don't think we're going to solve it. We're continually, as an industry like all others, evolving, iterating, getting better. The way people look at self-funding now, that smaller employers are looking at self-funding now, is completely different than what it was 10, 15, 20 years ago.
But so you would look at that, and this brings me to, I don't know if they call them a fable, but one of my favorite, kind of one of those little stories that you tell as an example, an allegory, if you will. People go, well, why bother, right? If I can't hold back the ocean, why bother? Have you heard the starfish fable? Yeah. So like the boy picks up the one and throws the starfish back because there's a bunch on the ocean shoreline. And the guy's like, why are you bothering? Well, I made a difference for that one. And I made a difference for that one. I think we all have to pick whatever our channel is or whatever our lane is and try to make the difference for as many employers or brokers or whoever we sell to as possible, knowing that we're going to have just a minuscule positive impact on the broader system. But isn't that better than nothing, would be my sentiment. Otherwise, why try, right?
Yeah.
If nobody wants to try, and no smart people like hopefully you and me and millions of others want to try, then what, do we just give up instead? Or we let the government take it over? I don't know.
No.
Yeah. I'm saying like you got to try, even if it seems fruitless and you don't know that you're making impact.
We're not going to get better.
Yeah.
I mean, excuse me, we're not going to solve it. We're getting better.
Yeah.
Everything's, toward that goal. You made me think of something else, like, are we going to solve this? No, but, we've got some really cool things happening in our industry.
Oh, yeah.
Precision medicine, I think, is incredibly useful.
Yeah.
This doesn't sound as cool as that, but advanced primary care, there's so many different things that fall under advanced primary care. I think that really helps change the landscape financially for employers, for health outcomes for the employees. The way that even Bluebook is helping people optimize existing formularies. Just because your doctor prescribes a medication to you doesn't mean that's the best medication out there.
Yeah. Oh, yeah.
Doctors have on average about 70 prescriptions that they prescribe.
Okay.
Any given doctor has about 70, and they'll be different from one another, from doctor to doctor, but they prescribe about 70. That's the statistic.
Okay.
They are not experts at pharmacology. Well, and they don't know your formulary.
Yep.
But if we know your formulary and we can tell you, okay, you can take that drug or you can take this one, it's going to cost you less. It's got better outcomes for that condition. You want us to reach out to your doctor and see if it's a fit? Yeah.
Yeah.
And we do that. So I think where we're going with precision medicine is great. You were telling me earlier about this really cool
Oh, Bexa.
Bexa, the breast scan for breast cancer. It sounds like it's portable. They got a lot of uses that are beyond a or not a lot of uses, but easier to use than a mammogram.
Minimally invasive. It can be done at like an employer's location as long as there's a locked door. I mean, it's like very simple versus a mammogram. Yeah.
So I think between precision medicine, advanced primary care, things like the breast scan, appropriateness of care.
Yeah.
What does that mean? Well, we talked about knee surgeries. Maybe you don't even need that. Maybe you just went to a surgeon and he just prescribed surgery because that's his area of expertise. Maybe you don't actually need that.
Yeah.
If we can intervene, and we meaning Bluebook, and say, you go to that doctor, they are over-prescribing surgeries, over-prescribing C-sections. Maybe consider a different doctor before jumping straight to surgery. If we can help people know that they're getting appropriate care, high-quality health outcomes, and at a fair price, we're not solving this, Spencer, but we are definitely impacting
Well, and I look at it and I imagine, what if everybody used it then, right? It's not just in one single employee base. Like get 100% of the people to utilize it there. What if everybody used a tool like Healthcare Bluebook? And I realize I'm not naive enough to think any one company can have the entire economy, but it's like, what if everybody used something of that ilk, right? Like what percentage of healthcare overspend or, unnecessary spend could be lopped off? Is it 10%? Is it 20%? I mean, it's got to be a massive number. We're talking in the hundreds of billions of dollars. How much would that improve the healthcare
This
system?
may shock you, may not.
Okay.
Anytime I'm doing an analysis, I don't care the industry, the size, employer, I don't care. I can tell you right now, and then I can prove this. You can give me an example case. I can tell you right now, they are overpaying claims by 50% of their claims are overpriced.
Yep.
50%. And only a third of their health outcomes are the best.
Okay.
So what does that mean? That means that people are paying way too much for subpar care. Every single employer, doesn't matter size, industry, how progressive they are right now, 50% of their claims are overpriced.
Yeah, I believe that.
That really means something
And
to
by
it.
how much, right?
Oh,
The question is, and by those 50% that are overpriced, how much are they overpriced, right? Which I know there's no answer to that, but
we know it. I can tell you.
Okay, yeah.
And we can tell that for each one of these clients or prospects. But then the other side of that was only a third are getting the best care.
Yeah.
So we're overpaying for subpar care.
Yep.
We can change that right now. You don't have to change your plan. You don't have to change your formulary. You don't have to change your pharmacy strategy as far as, other things you've got in place. We're just going to make all of that better.
Yeah. Well, I think that's a really good place to stop. I felt like that was a great summary of the episode. I will ask you if you want just like 20, 30 seconds of closing thoughts for the folks that have listened thus far. I'll give you the floor if you want to kind of finish us off there.
No, I think I'm good, Spencer. Appreciate the time. Looking forward to holding back some water with you.
Yeah, absolutely. Yeah. Well, I appreciate you coming on, and I know it's been a long time coming, but what you guys are doing really cool, and I'm glad we got to cover this as a subject for the podcast. So can't wait for this one to go out. Thanks again.
Thank you.
Bye.